Doc, Pat Rennie asked, why does my dog shake his head all the time?
Primarily because of ear infections, ear infestations, and if not one of those two, then it could be involved with some oral or mouth issues, or maybe even fleas around the neck and the face, or if none of those, maybe has something to do with the central nervous system or the brain.
Doc, if the ears are affected, how long does it take to show and how would you know?
Well, ear infections will show up within just a couple of days of the initiation of the ear problem. And it would show up by maybe having some swelling and some redness around the ear flaps and the top of or the entry of the ear, pawing at the head, shaking the head, which is what we started talking about. Even feeling the ear flap, sometimes it feels real gritty, but the most important thing is that when you touch the head, it seems like it's really uncomfortable or painful.
How do you know if it's an ear infection or ear infestation?
Well, ear infections are where pathogens like bacteria, fungus, and yeast invade the outer ear canal. Infestations are caused by microscopic insects called ear mites that are only detected with the veterinarian using the otoscope.
Are there certain types of breeds of dogs that get ear infections more than others?
The long, floppy-eared dogs like the English Cocker, the Labrador Retriever, Golden Retrievers, Rottweilers, and then the additional dogs that have excessive hair in that outer ear canal, like poodles and Shih Tzus, those are the primary targets for ear infections.
Doc, how do you treat ear infections?
Well, we like to treat the ear infections from the outside in and the inside out. Look at the anatomy of the ear. It's made up of three parts. This is the outer ear canal, where primarily you're going to be treating, the middle ear canal, and the inner ear canal, which is made up primarily of nerves. Cleanse the lumen, and we do that with an effective and safe ear cleaner like EpiPet. And then after it's cleaned, then we put in the medication, whether it's drops or ointment, so that it will attack this membrane because that's where the infection is. So that would be your outside in treatment. But to treat inside out, that's where we would administer an injection and or oral medication getting into the bloodstream and attacking that same membrane that is infected, so that now we're attacking from the outside in and inside out and have the best opportunity for success in treatment.
Doc, after treatment, is the infection gone forever?
No. Remember my showing you the anatomy of the outer ear canal and that skin lining? It's very thin, 4 to 6 layers thin. But after treatment, the pathogens, whether it's the bacteria, the fungus, or the yeast, actually will embed in that lining and lie dormant. So under certain types of stress conditions, maybe it's even just a change in the weather, can reactivate those pathogens. They'll start replicating and you may see an infection again.
Doc, are ear mites seen frequently?
That's a really good question too, because when people call to say they've got an ear problem, they usually tell the receptionist, my dog has ear mites. And that's really a misnomer because ear mites are really pretty infrequently seen in the cat and the dog world. Most of the time it's seen in orphan or feral cats that people adopt and bring into the house and mix with your other house cats or the home canines that are part of the family. It's easily transmitted body to body.
How would you treat for ear mites?
Well, you'd want to treat for the ear mites by treating the ear infection, as we've described. Then, after you treat for the ear infection, we have to eliminate the ear mites. And the best way to do that is to use topical flea and tick control products on a regular basis for at least 3 months.
Doc, you mentioned oral and mouth issues, fleas, and brain lesions might cause the head shaking.
Yeah, once the veterinarian evaluates the head shaking and discovers that the ears are not the issue, then the other alternative would be something in the mouth. So he will examine, or she will examine the mouth, looking for oral issues, and then really examine the neck and the head region for those pesky little fleas. And finally, if you can't find any of that, one has to be concerned that there's maybe a brain issue, and then the veterinarian will probably refer you to a neurological specialist, a veterinary neurological specialist.
Doc, as pet parents, can we prevent ear infections?
Yeah, simply keep the ears clean with regular cleaning with an effective and safe ear cleaner. And in addition to that, for the pets that have excessive hair in the ear canal, make sure that the hair is regularly removed so you don't collect a lot of debris and leave the opportunities for ear infections. And if you have any questions, please bring those questions to us in the comments. We may include that in the next episode.